I am Sanjana, Onco nutritionist from ZenOnco.io. Today we shall be speaking about an important topic which is lymphedema and what are the strategies which can be used in preventing or reducing the lymphedema in cancer patients. Before we go ahead, let us try and get an understanding of what is meant by lymphedema. Lymphedema is a swelling of a part of the body, usually a limb. So, lymphedema can occur as a side effect of the cancer treatment when the lymph nodes have been removed or they have been damaged. So, what happens is this causes the lymph fluid to build up in the tissue which is present in under the skin. Okay, so this is what it is. Now let us try and understand as to what are the common side symptoms of lymphedema which are noticed. So there is visible swelling which is observed, there is a tingling sensation which can be there. Okay, movement of that particular affected limb because of the buildup of the lymph fluid, okay, that can be restricted. You can feel a tightness or a heaviness in the limb, and there could also be pitting of the skin as well. So now let us try and understand like what are the various causes of lymphedema. Okay, so as we have know that lymphedema can affect a person after treatment or during the treatment as well. All of this is going to be dependent upon the location of the cancer, its stage, and also the type of treatment which a patient is undergoing. Okay, so what are the risk factors or what are the causes of lymphedema? First of all is there are certain type of cancers that can affect the lymphatic system. Next is the radiation therapy. This is going to be damaging the lymphatic system. Surgery wherein you are going to be removing the lymph nodes. Okay, and infection in the limb is another risk factor for causing the lymphedema also. Certain chemotherapeutic agents as well. All right, now let us try and understand as to what are some of the strategies which can be followed in reducing the lymphedema. So first of all is the MLD or the manual lymphatic drainage. This is a type of a gentle massage which will help to move the lymph fluid out of the affected limb. Next is compression garments. Now, specially designed sleeves or stockings have been developed to maintain the pressure on the limb and to prevent fluid from accumulating. Next is exercise. Gentle exercises can be performed but under the guidance of a healthcare professional. This is going to be helping in improving the lymph flow as well. Next is skincare. Good skincare practices are also essential because it will help in reducing the chances of infection which can otherwise worsen the lymphedema. Okay, next is pneumatic compression. So pneumatic compression is basically a device which is going to be using the air pressure to manage the lymph and to move the lymph fluid as well. Okay, so now let us try and understand some of the dietary approaches which can be applied to this, which is also going to help in reducing the lymphedema. First is a low sodium diet. Okay, a high salt intake has been shown to cause water retention, and this can lead to lymphedema and worsen it. So it is always important to get a consultation with your nutritionist, who is also going to be understanding your taking a nutritional assessment in understanding your dietary recall. Also she will be monitoring your and checking your blood reports as well, and understanding and guiding you as to what is the optimal intake of salt which is recommended in your daily diet, so that it will help you to reduce the lymphedema as well. So basically when we say we aim at a low sodium diet, mainly high sodium foods are your processed and packaged foods or canned foods as well. Yes, you can also add less salt while you're cooking a particular food. Next is an anti-inflammatory foods, right? So there are several foods which have anti-inflammatory effect, meaning they are going to be helping in reducing the overall inflammation in the body. So these are going to be your fruits and vegetables, your nuts and seeds. They contain healthy fats, which is omega 3 fatty acids, and it is a rich source as it is going to be helping in anti inflammatory properties as well. Other foods which contain omega 3 fatty acids are your flax seeds and your chia seeds, which you can surely incorporate in your daily diet, because these are also going to play a beneficial role in helping to reduce the inflammation in your body. Next we say is hydration. Yes, whenever a patient is going to be having treatments or irregularly, also hydration plays a very important role. Why? Because it is going to be helping in making the body stay well hydrated and not becoming weak, right? So what happens is drinking adequate amount of water has been shown to be essential for the lymphatic health, as it will help the lymph fluid to move more easily. So at least you have to drink 2 to 3 liters of water in a day. Next is protein rich foods. Now, adequate protein intake, as we know, is essential for repairing the body tissue and to maintain a healthy lymphatic system. So, you need to opt for plant based protein sources such as your lentils, your beans, pulses, and legumes, and your soya products as well. Alright, so to conclude, yes, it is very important to, you know, observe the signs and symptoms of lymphedema and get timely treatment for your doctor. Also, it is important to follow a well balanced diet wherein you're going to be taking care of low sodium intake. Ensure that you stay well hydrated. Don't forget to include your anti inflammatory foods in your daily diet, and also try to incorporate one protein rich food along with your meals. Thank you so much for watching my video, and we are here at ZenOnco.io to navigate you through your cancer care journey. In case of further assistance, you can always reach out to our cancer coaches on the below mentioned contact number. Thank you.